attend. However, we understand that there is a lot of information that keeps changing, as well as information that needs to be shared. And I believe some of the issues that were brought up last meeting, as I was told, is how do we ensure that some of the information is made more available to the public, and how can we make sure that people that are seeking information would have it. There has been a great deal of extra information that we are updating as we move along on our website, specifically as we are now moving towards the senior vaccine dates and the campaign. We have that updated. We are using as well several of the media outlets, which in hindsight, some of the information probably backfired in making this more available for a lot of people, and it created a little bit of burden on our communities. So we are learning as we go, as they say, and what is a fair balance between what we need to have available and what is on a need to know basis, if we may call it that. So I think with the
Excuse me,
yes.
Dr. Hamami, can you give your name for the record, please? I don't think we did that part.
Okay, I thought I did. Mohanad Hamami, Chief Health Strategist.
Okay, thank you.
Sure. I think on Thursday, when I had the opportunity to share most of the updated data with the full board, we forwarded that presentation to the clerk, and that is made available. We're looking to see, I know several commissioners called and asked whether that can be put in some way or format on the website. Currently, the website, I don't know how many of you had a chance to visit that, contains a dashboard of vaccines that were received and vaccines that were administered, as well as doses that are scheduled. So this is something that we keep updating on a weekly basis. It also contains the latest information as it relates to where seniors can get their vaccines from. We have a frequently asked questions based on the call that we had this morning with the communities. That document as well is going to be put on the website. So that's the update in what we're doing in ensuring that information is flowing to those that need it, and ensuring that we have communication happening. If you would like me to go into the second item and giving you a quick update on our efforts in Wayne County, and I wouldn't go into the full what we talked about at the full board, but there has been some minor updates. If you don't mind, I can share with you.
Yes, thank you.
Absolutely. And it might be helpful if I just show you, it's only 9 slides, so nothing major, but it would help in following with me. I hope that you can see my screen. This is for the reporting period of February 14 to the 20th. These are the total new cases of last week, as well as the number of deaths. But this is the graph that I wanted to show you. I know we talked about this. We talk about this with communities. These are the 14-day look back, and we take a 2-week look back of cases and we draw a trend. And what is so nice about this graph is here, this steep drop that is so beautiful, for especially for data geeks like me. When they see something like that, they get too excited, and saying that means we are literally at where we should be, and hopefully this will continue, although I think we're going to see a little bit of bump based on the cases that we saw yesterday. These are the top 10 communities in Wayne County. We compare them from week to week. Again, no major changes in the top 3. Dearborn, Dearborn Heights, and Canton are still in top 3, but there has been some changes in the total percentages of cases in Wayne County. Dearborn is dropping. Dearborn Heights picked up 2 points, and Canton 1 point. Again, these are all depending on the new cases that we're seeing in our communities. Our 7-day positivity rate from 3 periods ago continues to drop. We are, as of yesterday at 3 p.m., at 4.4% in Wayne County, and that is compared to 3.4 in the state of Michigan. But again, if you look at the trend, then it is going down. Nothing has changed since we reported on 9 of the B117 variant cases in Wayne County. We still are at 9, and we hope that we don't get any new cases. Let's talk about vaccines, which I'm sure everybody wants to know. So as of yesterday, we received our new shipment of vaccine, and by far, this is the largest we have received so far. So we received about 15,000 new doses. That is split between 5,850 Pfizer and 9,800 Moderna. But we also received our allotted for second doses of 5,850 of Pfizer and 2,400 Moderna. So in totality, we received 23,900 doses, which compared to what we were getting in the past, this is the largest shipment we had so far. Hopefully this will continue, and that these numbers, the 98 here and the 5,850 here, is what is enabling us to go out and now take a big chunk of the senior population that is out there. We have so far administered 40,000 doses, and that doesn't count some of the doses that we gave for other entities to help us with administration, which are around close to 2,000 doses as well. This is the schedule that our priority phases. We have completed everybody for dose 1 and dose 2, and by everybody, those that wanted to have the vaccine, those that are in critical healthcare, the long-term care. We are still tackling the necessary healthcare, the providers, but their numbers are getting smaller. We have completed all the public safety, law enforcement, the educators, and correctional staff, and in 21 days or less, we will start doing dose 2, and now we are in addressing the 65 and older. That includes 65 to 74 in Group 1C and 75 and older in Group 1B, and these are in progress. Of course, these were also and still are being handled by health systems, as well as retail pharmacies, Myers, Rite Aid, and others, including several geriatric clinics and FQHCs. So that's where we are. This is the schedule that we shared with the full board on where we are going to be. We started today, both in the city of Romulus and in Hamtramck and Highland Park at these 2 locations. So far, as of noonish, we received notes that everything is going great and everything is going according to schedule. We are seeing more, actually, than that was scheduled. Specifically in Hamtramck and Highland Park, we have to send back to bring more vaccine because we were expecting 300 today, and I think we surpassed 500. So we continue with the schedule. Some are I don't think this is going to change much. We are working on the schedule for next week, and as many of you who were on the call this morning with the communities, there has been a lot of lessons that we learned from going through this, and I'm sure we'll continue to learn and to see whether we can tweak the operations a little bit and ensure that what we are doing is serving our citizens and